My name's Amy Schofield. I work as a psychological wellbeing practitioner within the Wiltshire Talking Therapy Service, and alongside that, I'm an older adults champion. What it means to be a champion is kind of having some allocated time within your week where you can focus on an area within the service that you're especially passionate about. There's time set aside each week to engage with the role, and it means that you might be kind of a go-to person within your service regarding your champion area. So for myself, I often have emails and meetings with other practitioners seeking advice regarding an older adult they've been supporting, or they might be seeking advice about particular signposting that could be relevant for their patient. Being a champion can be quite clinical, or it can be a bit about sharing knowledge with others, but it can also be about finding additional training and sharing that with the team. Or it could be about engaging and organising outreach to help improve access to the service. So one of the reasons that we need older adults champions is particularly relating to my previous work. So a large portion of my previous adult working life was working in care, supporting older adults. And something that I witnessed as a carer and senior carer was that most people were not aware that older adults would be eligible for talking therapies. Most people seemed to be under the impression that medication was the main option for older adults. And I often look back and wish that I'd kind of been aware of this. Now that I work in talking therapies, I know that there is no upper age limit alone that would sort of preclude somebody from having support within our service. Therefore, the older adults champion is really important, as I feel so passionately about ensuring that everyone is able to access talking therapy support should they need it, and to make not only older adults directly aware of this, but also any other services or groups who might be supporting them too. What I've done in this role in the past and some of the things I've got planned in the future relates to improving access to talking therapy service in the form of outreach talks or contacting specialist services that older adults might more regularly use to make sure that they're aware of the service and that they're eligible for the support if needed. I've also attended various training courses and continue to create useful resources for our practitioners to refer to, including a signposting resource that I regularly update and add to, or a frequently asked questions resource that helps to arm our practitioners with all the knowledge and information that they might need. And lastly, things that would be helpful to hear back from service users about what they would like to see from their champions. I would say that any and all feedback is very welcome. It would be great to hear from any patients we've supported who are over the age of 65 to hear what they have found has worked well in the service, but also things they felt haven't gone so well so that we can consider how best to improve. It would also be really helpful to hear from loved ones or carers of our older adult patients, provided they're happy for these people to offer feedback, of course, just to see how they found the service inclusion and accessibility for their loved one from a slightly outside perspective. We're always looking to improve, and we're happy to hear what's going well, but also what's not going so well and how we could improve moving forwards.